என்ன இவனுக்கு தயார் பண்ணிக்கிட்டு இருக்கானுங்க? எஸ், எல்லாம் போலி மருந்து. அட்டாக் பண்ணுங்க சார்.
வெயிட்.
போலி மருந்து ஃபேக்டரி கன்ஃபார்ம் ஆன பிறகு எதுக்கு சார் வெயிட்?
அந்த பீட்டர், அவன் முகத்தை நான் பார்க்கணும்.
சார்,
அட, நம்ம ஊர் பொண்ணுங்களா? சூப்பர். நீ ஏற்கனவே இங்கே வந்திருக்கல? அவனுக்கு தெரியுமே, முன்னாடியே வந்த பொண்ணு திரும்ப அனுப்பக்கூடாதுன்னு. ஜார்ஜ், ஓ வாட்ச் கேமரா. என்னம்மா கண்ணாடி ஹேர்பின் எல்லாமே வந்துருச்சு. வாட்ச் கேமரா எவ்வளோ பழசு தெரியுமா? ஜெய்சங்கர் காலத்திலே பண்ணிட்டாங்க. ஹலோ தெருக்கோடியில் வேனில் உட்காந்து ஐபேடில் பார்த்துட்டு இருக்கீங்களா?
கைஸ், அவன் உயிரோட வேணும்.
yes, copy that.
Go.
கலரிங்லாம் பார்த்தா மீடியாவா? போலீஸா இருந்தா ஐயோ, இப்போ உடச்சுலாம் குதிப்பாங்களே.
Assalamualaikum warahmatullahi wabarakatuh and good day. I'm Madam Rose. Today I'm going to give you a lecture on pain, opioid analgesic and antagonists. Okay, for the learning outcome, students should be able to describe pain system and principle of pain relief. Second, to explain the function of opioid receptor. Third, describe the mechanism of action of opioid analgesic in treatment of pain. Number 4, list common side effects associated with opioid analgesic. Number 5, compare and contrast the effect of morphine with the other opioids used for analgesic. Pain definition. Pain is an unpleasant, subjective, sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. There are two types of classification of pain. First is acute, second is chronic. For acute pain symptom, there would be a sharp or dull, burning, tingling, shooting, radiating, fluctuating in intensive, or it also can be varying in location and occurring in a timely relationship with an obvious noxious stimulus. The sign would be the high blood pressure, high heart rate, diaphoresis, mydresis, and also pallor. Why the chronic symptom? It often occurs without a timely relationship with a noxious stimulus, and it can change over time to dull or vague. The symptom of chronic, it could be maybe associated with other comorbidities. For the pain classification in terms of pathogenesis, there are two, nociceptive and also neuropathic. If we look at the nociceptive, it consists of somatic, which consists of skin, bone, joint, muscle, and connective tissue. While the visceral, it comes from the internal organs such as large intestine or also pancreas. Now we move to the pathogenesis pain from the neuropathic. It can be from the peripheral nerve, nerve root, also CNS, which can cause by the damaged cell like from the diabetic neuropathy. Okay, this is a scale for pain assessment. You can read this after the class. In this slide, I'm going to explain you the pain perception pathway. Basically, there are a lot of pain perception pathway, but here I'm going to focus on substance P and also glutamate. Substance P and glutamate is a part of the pain neurotransmitter. When you get hurt Okay, what happened here? Neurotransmitter will produce the substance P and also glutamate, and this neurotransmitter will be transmitted to the brain. And what happened at the brain? Brain will react with this by descending inhibitor pathway inhibition, nociceptive transmission by utilizing the serotonin, endogenous peptide, GABA, and also norepinephrine. Why we need to manage the pain? For the acute pain, of course, we want to provide the reasonable comfort. And for chronic pain is for rehabilitation and resolution of psychosocial issue. Okay, there are few terminologies that you need to know. First is the opioid. What is opioid? Opioid is a term refer broadly to all compounds related to opium. While the opioid is a natural product derived from the poppy or the Papaver somnifera opi album, which consists of many alkaloids and about 10% of them are morphine. While the opiate is a synthetic drug derived from opium, morphine, and also codeine. Third is the narcotic, derived from the Greek word for stupor, or generally referred to any drug that induce sleep, and it also not associated with opiate. While the analgesic is a drug for medication to give a reduced pain without consulting in loss of consciousness. Okay, this is the diagram of the poppy plant. Okay, poppy is a type of plant, type of flower which can produce the extract juice, what we call as a opium. Okay, and then from here we can produce the opiate, morphine, and also codeine. You can read this later after the class. For opioid receptor, all opioid drugs act by binding to opioid receptor like a mu, delta, kappa in the CNS to produce effect that mimic to endogenous opioid peptides, while the analgesic properties are primarily mediated by the mu receptor. Okay, here this is the function of the subtype of the receptor. First, we focus on the mu subtype receptor, which function to responsible for most for the analgesic effect and major adverse effect are sedation, euphoria, respiratory depression, and also reduce the GI transit. While the delta receptor subtype, the function is more important in the periphery and it also may contribute to the analgesia. While the kappa subtype receptor may contribute to the analgesia at spinal level, produce less effect but may also contribute to sedation and also dysphoria. Okay, what is the differences between the endogenous opioid peptides? Opioid peptides are short sequence of amino acid that bind to opioid receptor in the brain. Endogenous peptides are opioid peptides that are produced physiological in our body itself. Okay, there are three families of the endogenous opioid peptides. First is the endorphin, second is the enkephalin, second is the dynorphin. Enkephalin consists of two subtypes, what we call as a met-enkephalin and also leu-enkephalin. This type of endogenous peptide can react with the opioid receptor like mu, delta, and kappa. All opioid receptors are G protein coupled receptor and inhibit adenyl cyclase. Cellular action of opioid receptor in analgesic modulation, it can be two. First is the closed voltage gate ion calcium channel on the presynaptic nerve terminal, which can reduce the transmitter release. Second is the open gate of the calcium channel at the prosynaptic neuron, which can cause the hyperpolarization. Okay, this is the mechanism of action of mu opioid receptor agonist. What happened during the pain stimulation? Many glutamate will be released at the presynaptic. Okay, when the opioid bind at the opioid receptor, what happened here? This ion channel for calcium will be inhibited, and the calcium ion will be reduced in this presynaptic, and this will block the glutamate. At the same time, when the opioid bind to the opioid receptor, what will happen here? It will stimulate the calcium will be pumped out from the prosynaptic, and what happened here? The excitatory response will be reduced. Okay, there are three steps to manage the pain. If the patient experience the mild pain, we can use the non-opioid analgesic like PCM and also NSAID. If the patient experience from the moderate to the severe pain, non-opioid or mild opioid can be used. Depends on the situation, depends to the patient. If the patient have a severe pain, maybe strong opioid or non-opioid can be used also. Here we are going to focus on drug classification. First is strong agonists, typically morphine-like drug, which have high affinity for mu receptor and generally low affinity for delta and kappa receptor. Second is the moderate or low agonist. It is type of analgesic and side effect lesser than the morphine and do not cause the dependence. Third is the partial agonist and mixed agonist antagonist, which combine degree of agonist and antagonist at different receptor. Antagonists produce little effect when give alone but block effect of the opioid receptor. And other analgesic, it can be like a tramadol. Okay, class, this diagram show how the receptor of opioid mostly react. Like here, mu receptor highly react at the supraspinal, respiratory depression, and also euphoria, while the kappa receptor mostly react at the function of for dysphoria. Okay, something like that. You can read this after this. Okay, and stay tuned and to be continued at part 2.